We are actually going to have our speaker come on. We have two speakers, and we are going to start with our first speaker, who is going to be Reverend Victoria Triano. And Reverend Victoria Triano, you come from Southington, right?
Right, Southington,
Yes.
that's right, yeah.
So I'm just going to let you introduce yourself and also talk about the work that you do within your community, within the prevention, within the faith sector.
Great. Thank you so much.
Awesome.
This is really great to be part of all this whole conversation. We established the STEPS program in Southington. And my goodness, it's been a long time. And it was founded by a few community members, and I was blessed to be part of that after we had a number of teenage suicides in Southington. And we came together at a loss and saying, what can we do? And we started talking. I was pastoring in East Haddam, and I had heard through their youth group in East Haddam that they were part of the search team. And so I knew nothing of it other than to say it. And John Myers, who was the head of the YMCA at that time, knew all about the search group. And we contacted them, and we got a framework to springboard our STEPS program, our prevention coalition in the town. As far as the church community is concerned, of course, we have a representative there. I'm kind of emeritus now. I've got my hand in a lot of things, but I'm very close to all of them still. So there you have a slot there where there is actually a local pastor sitting on the STEPS community and working with them diligently. And I have to say, it is a very important factor that the bridge be made to the faith community. It is so clear because there are resources and there are so many factors that are involved that the faith community can provide. Now, it's true, actually, you mentioned it, that we have differences of faith beliefs and structure of our churches and synagogues and worship centers. But we at the heart still, we all are very much committed to helping those that need us and that need encouragement and that need undergirding and that need a vision for the future. Because many times, as all of you know, you are all the experts, not me, but you know that when we finally contact somebody or make that connection, we find that they are in pretty rough shape and hope is gone, and they have burnt their bridges with everyone they know, and yet here we are giving them hope and also an opportunity to go forward. So also, and the other thing about faith communities is that we have a reservoir of people that are with us in our community, our local churches. And so it's not just one idea that comes from one person or even the pastor for that matter. It's something that can come from the faith community itself in terms of mobilizing within the community to bring the word of the work of the coalition out to the community. The fact that they are a present help, they're there, they're ready to extend themselves, and I think that they're in it for the long haul. I think you find that much more in faith communities. It's just not a 30-day detox program or what have you. That we're in it for the long haul, and you mentioned it actually in your presentation that the sustainability is so very important for us, that we don't receive people as drug addicts or alcoholics or whatever. We receive people as into our family, and that is very important for the sustaining help for that individual. And the whole church rallies, or the whole faith community rallies around that person, because they're not out there, but they're in here. So I would tell you that we are very active in our coalition in Southington, and continue to be so. So we're very excited to always help the coalition. So
Thank you, Victoria.
sure.
Does anyone have any questions about Victoria's involvement in her coalition, or her involvement in prevention, or how they can incorporate faith within their coalition?
I would just add one thing while you're all
Yes.
thinking about how how do we do this. The whole idea of faith is based on relationship.
Yes.
It's based upon our relationship to our God. It's based on our relationship to one another. It's based on our relationship within the community. So if you're not sure, I would really suggest that you reach out and make that connection with a church that or a faith community that you know within your community. Touch base with the head of that congregation, whether it be a pastor or a rabbi or a imam, whatever. But I think that's really important to take that first step. They may not reach out to you because it's kind of a foreign thing for us. But boy, if you reach out to them, I think you'll find a reservoir of help.
Kelly has a question.
Hi,
Hi.
Kel.
So as somebody who's working in a newer community, I've been here for, in West Hartford for about a year, but I'm kind of overseeing a prevention partnership, trying to get it up and running. So what is the best way to reach out to leaders? Like I, at one point was just like doing a search online and trying to like go to the website and there's general email boxes, but I feel like those aren't always very effective. You don't always get responses from those. So I don't know if you have any feedback or advice around how to really identify and actually the best way to reach out to folks.
That's a great question because so many times we're individuals out there doing our own thing. I would check, Kelly, to see if West Hartford, and they must have an interfaith clergy association. We have one here in Southington, and it's called different names, but many times there's an interfaith clergy association where the faith communities, we don't discuss necessarily doctrine, but we do discuss how to be a presence within our communities. And so you're in West Hartford, correct? So I would start there. I would start to check out, maybe even at the town hall level, they may have a phone number for you or a person that's in charge of the Interfaith Clergy Association, and you might want to start there and ask if you can speak to them in their meetings and let them know what a wonderful work this is and how important it is for the whole community, and go with it from there. So that would be my encouragement to you, and also if you can think of you hear of a pastor that's very involved in the community, reach out specifically to that pastor, ask them or her if you can spend a little bit of time talking about it. But check out the Interfaith Clergy Associations. Usually there are, or there are perhaps with the Jewish community, there might be a coalition of rabbis that get together specifically for the Jewish communities that are represented, or the Catholic coalition, or talking to local pastors of different churches. So that would be my suggestion. I hope it works.
Awesome.
Thank you.
Thanks so much.
If I can just hop in, you might ask your coalition members too. Do any of them have, relationships with particular pastors? Are they a member of a church? Is their church, looking at either substance misuse or mental health or youth development? Are there some mutual goals or mutual interests there?
Awesome.
That's
Thanks
good.
so much. We have our next speaker, who will be Reverend Robin Ross, who will be speaking for us as well. Oops, sorry. There we go. Robin, are you there?
Yes.
Okay, awesome. There you go. So
Good
Robin
morning.
will be focusing on her congregation and prevention efforts in her congregation, and how they have incorporated faith within the congregation and coalition areas.
Good morning. I actually work for the Ministerial Health Fellowship under the leadership of Pastor Robin Anderson, who is actually on the call today. She developed a program called the How Can We Help program. We started out into the year January of 2020. We started out as a faith-based organization working within the church, where we facilitated meetings for those who are combating opioid use, substance abuse, alcoholism. And then once the pandemic hit, of course, that was cut short. I decided in the month of April that instead of going online, which I felt was very ineffective, especially with that population, because people like to be seen, they like to have that close contact, in-person contact. So I asked my boss if I could facilitate meetings at a park, of course, using social distancing and safe measures. She agreed, and so we began to have our meetings at the Harbor Park area in Middletown, Connecticut, in which all of the people that we work with were very grateful, because at that point their life had become disruptive. Everything they knew was now online, in which a lot of them didn't have the proper mechanisms to go online or to have the Wi-Fi to be able to connect to teleappointments and stuff like that. So it was greatly appreciated. It grew to as many, we had as many as 35 people at one time at a meeting, for a while, and we still keep up with the numbers. We're in between 20 and 30 currently that are consistently coming, that have been coming for the last 3 years. We also, Reverend Anderson has also developed the opioid task force. We work alongside with Middlesex Hospital, the soup kitchen, the health department, the fire department. I believe we're bringing the police department on board. She can elaborate a little bit more on that if you'd like. And just being out there in the community, making ourselves available. I agree with Reverend Triano, building that relationship, accepting them as people, not labeling them or stigmatizing them as a drug addict or an alcoholic or this or that, as society has done. So often we bring them on as people, we treat them as people, as human beings, as, someone that God has created. And so they build that trust relationship with you. And I have most of my people that are in the program who started in 2020 are still with me now. So, and that's because I believe because of the way Reverend Robin runs the program and what she has instilled in us as people who work up under her, and also what's inside of, us, it affects the way we treat and interact with people. So it's a very successful program. We're out there, we comb the streets. As far as, getting our information out there, we comb the streets. We go door to door, knocking on people's doors, telling them about the program. We have host events where we talk about what we do as far as the opioid protection, because our team is just not, because it does not just consist of recovery coaches working that field. We have case managers, we have coaches, crisis counselors. So we're out there as a team. We set up events where people can come get information about what we do, and we're pretty much all over Connecticut, if I'm not mistaken, Reverend Anderson. We pretty much cover the state of Connecticut, and I think that's about it. I also go around to different businesses, like the Eddy Center, the Rushford Center, the Shepherd Home, which is now a veterans home. I talk to case managers there. We try to get inside those places. We just recently got inside the Women and Children Center in Middletown on Eastern Drive for pregnant women who struggled, or recent mothers who became I'm nervous, guys, just forgive me. Individuals who have become mothers recently, and who had, combated opioid addiction or substance abuse. So we're in with them now, which is great. We just got in with them, I want to say a couple of months ago. So that's great. We're working our way going into the Eddy Center for those who cannot come out on the incarcerated side. So it's really just a rewarding work, great work. And I just really love what I do.
Thank you so much for sharing with us, Robin. Does anyone have any questions for Robin about the work that they do? Whether it be to Reverend Robin Ross or to Reverend Robin Anderson?
What was the name of the program again that they run?
It's called the How Can We Help program under the umbrella of the Ministerial Health Fellowship.
Can you repeat that, please?
The How Can We Help program under the umbrella of the Ministerial Health Fellowship.
Also, will there be contact information for anyone that's speaking today?
Yes, I can put mine in the chat, definitely.
I would love that. Thank you.
There is a variety of different faith-based programs to help people in recovery. And I think it's an area that churches are addressing more and more, that faith-based, recognizing that they provide a really special place, those relationships that both Reverend Triano and Reverend Ross were talking about, the importance of those relationships and those connections, and the churches being a safe place. The other thing I wanted to give a shout out to, Robin, I was addressing something in the chat box, so I'm sorry if I missed it. But the work you do with the Middletown Coalition, you're based in Middletown, and you are an active member of the Middletown Prevention Coalition and have gone to the high school to do tabling events for the resource fair, and you bring your perspective to the meetings and volunteer for different events. And I just wanted to give you a shout out for being that as well.
Thank you.
Thank you. Good morning, everyone. My name is Robin Anderson, and as Robin has mentioned, the How Can We Help project that she works with and does an excellent job with, that is a program of the Ministerial Health Fellowship, but there's a faith-based organization that, one, we advocate to address health disparities and also policy changes as it relates to health care for people of color. And as a part of that, we have other direct services programs. And so one of the things that I wanted to mention on today, and I thank God that you're having this forum also on today, is to remember that, faith-based organizations are a valuable resource in the community. And that it is our goal. That's part of what we do. We're an organization that works on healing and deliverance, but also every church that's in every neighborhood is not just the church in the neighborhood, but they are an integral part of that community as well. And so as a part of being a part of the community, these are things that we've always done in terms of working with people within our congregations or in the community that have substance use issues, helping them with prevention kinds of things also. And so, again, we are a valuable resource to use in any community to be able to have programs in churches, in program there, and then also to be able to engage the community in some of the services that you are providing. And that we really are great partners also. Many times people come to us and they kind of tell us about their program that they've already established, and they ask us to be, to be a part of it and say that it's a faith-based program, but yet and still doesn't really include us in as a real partner. So I just wanted to say on today, thank you so much for having this forum on today. And also, really knowing that no matter where you are, remember that the church is also an integral part of that community, and certainly is a resource for you in any program to provide the services that will bring healing and deliverance to all, no matter what race, creed, or color that they are. So I just wanted to mention that on today. Thank you.
Thank you both for sharing. Thank you. I want to, at this moment, pivot back to some things in our presentation and talk more about, cover some things that other people are doing as well within the prevention landscape with other faith-based organizations. Prevention team is, TTAS team, is this showing the correct screen?
Yes.
Okay. So some of the prevention highlights that we have with the faith sector are that there are leaders within our community, such as Margaret Lancaster, who is one of the health program coordinators at Ledge Light Health District, has been going into the community in New London and training faith leaders at the Maudry Temple Church on how to administer Narcan for opioid overdose treatment. As well as there has also been more research done in the partnership of faith-based organization in spiritual guidance. So Dr. Ayanna Jordan, who is a Yale psychiatry professor, has begun working with a program with the Dixwell Church in New Haven, which is one of the oldest churches, the oldest African-American churches within New England. She's been working with this church in order to pilot the Black Church program to integrate cognitive behavioral therapy and spiritual guidance tools in order to increase retention in substance misuse treatment for Black Americans. So this church is still one of the largest predominantly Black American church populations within New England. And Dr. Jordan seeks to use this work that she has in behavioral therapy to increase positive mental health outcomes with Black American people in a way which is more culturally appropriate and significant. So I also want to begin to understand your levels of involvement with this sector. So we've talked a bit about what everyone's currently kind of doing within this sector a little bit. Also, we've gone over what some of our shared experiences are, but let's also talk about the levels of involvement. There are currently 5 levels of involvement, which range from no involvement to collaborative involvement. No involvement means that there is no engagement whatsoever. You guys do your thing and we'll do our thing over here. Networking is that we'll talk and share some information with each other, but we're really not at the point where we are necessarily engaging in each other and having a partnership necessarily. We'll talk about community issues and what kind of stakes those have for our community, but we're not using that information necessarily to work with one another. Cooperation is when the faith-based organization and the coalition are working with each other to support each other's program. So I'll support your program if you support my program. In other words, if you take your flyers and your co-sponsor trainings and put them out, then I will also take your flyers and I will co-sponsor your trainings as well. We'll do an exchange on different resources. Next, we have coordination. We'll partner together on a couple events together. So we'll serve together on some event planning committees or some community boards with each other and implement some programs together. And sometimes we have we'll meet each other halfway sometimes and we'll work together on like one-off events. We are on our way to having a collaboration, but right now we're just coordinating different things together. Finally, we meet collaboration where we have formal agreements in place that we are building a commonality with each other where we have a comprehensive plan to address issues within the community and our missions overlap with one another. We are building a common workforce and we're handling fundraising efforts together. We're building data collection systems with one another so that we can work forward on a common mission and a common plan. So right now I'm gonna engage you guys and see right now what is your current involvement with the faith sector. So I'm gonna have my colleague Jen open up another poll and get some feedback from you all about your current involvement with the faith sector right now. We'll do like 10 more seconds.
Looks like everyone's done, Shay, okay?
Okay, we'll go ahead and close it out. Okay, so it looks like a lot of people are currently not involved or are currently networking with the faith sector. Some people are moving more towards that cooperation and coordination area. And then we have just a little bit of people who are kind of doing that collaboration. If I could, I'd like to ask the people who are currently not involved, why currently are you not involved? And do you think that there are some ways that you want to kind of get involved with the faith sector?
I'll share.
Go ahead.
In Ellington, actually, there's a really strong presence of the Apostolic Church.
Okay.
And they are a very tight-knit community, extremely tight-knit. So much so that I think a takeaway from the presentation, and just also it's important to remember that other churches do exist within Ellington that might be, as thinking about community readiness and different levels of readiness and engaging them. It might be better fit to be speaking with other church communities within the community. It's been a hang up, I think, for us to kind of wrap our heads around. I mean, they're so intertwined with local businesses.
Mm-hmm.
So they are an extremely important asset and part of the community. And I think, that's just been some of the reasoning for at the lack of involvement.
Okay. So do you think that it's more so that you, instead of reaching out necessarily to other churches, you see that this larger church that's more tight-knit has more of the resources and more of the capacity that you want within your coalition, and that's why you're seeking to go, your coalition in the past has been seeking to make that connection with this church as opposed to some of the smaller churches in the area?
Yeah, and
Okay.
I think in the past the coalition has been involved in I believe one of the churches that wasn't the Apostolic Church. So but I believe someone retired or COVID happened and lack of involvement also followed suit with that. We maybe just have to pivot our goals a little bit as far as involving them at this moment.
Okay. So just a takeaway from that, I think, is that sometimes going for some of the bigger churches and getting involved with the bigger churches might not necessarily be it could be your goal to try and break into that, but it doesn't always have to be. There are other faith groups and other organizations that you can involve yourself. If you're seeing that there's been a little bit of pushback, maybe you can involve yourself with some other organizations that maybe this church or maybe this organization might not be the best fit for your coalition. And maybe you can try and reach out to other groups and other faith-based organizations to try and make that connection a little bit better and try and make that, build that capacity that maybe those other churches might not necessarily have within that area. So that's kind of my takeaway from it. If you guys want, feel free to add some more topics in the chat box that you guys kind of want to talk about, or if you guys have any suggestions for Mallory, go ahead and add those to the chat box as well. So some of the things I also want to go over are our barriers to engagement. So barriers to engagement are understanding that some faith groups have complicated relationships with substance use and how they address the matter. For example, Abrahamic faiths versus Asian faiths or New Age faiths have different ways in which they may address these matters. And there will be, of course, different ways we engage engagement occurs dependent upon how traditional or how conservative, how liberal the faith group could be, as well as understanding the roles of different members of a congregation and how members of the faith sector participate in coalition or prevention efforts within their sector's capacity. So understanding, okay, does this sector allow women in leadership? And what is the role of a youth leadership in a population, if there's any? So if this sector that you're working with, if you're working within a religious sector where women are not seen in leadership, and you as a female coalition coordinator are in a position of leadership, is that going to be a conflict with working with this particular faith group and understanding, okay, how do we navigate this? So there can be a lot of like dynamic when it comes to working with and engaging this sector. Sometimes coalitions might not be doing some of the legwork, the initial legwork that it takes to engage this coalition initially. So I think we had, sorry if I get the wrong person. Kelly earlier said that calling or emailing wasn't working when it came to reaching out. And sometimes calling or emailing may not be the best way to reach out to this particular sector. And you might have to get some legwork in to engage this sector and do more in-person networking and relationship building by going in person to some events that this sector might be having. So engaging this sector. Now that we've talked about your current involvement and things that you have currently done to try to engage the sector, if you have, some of you have currently not engaged this sector. I want to take a couple of minutes to see what things, if any, you'd like to use as a way to engage this sector. So I'd like everyone to take this time right now to list two things, two ways that you think would be great ways for your coalition to engage the sector, using some of the ways that you've learned from this presentation and from our speakers, Reverend Victoria and Reverend Robin. Two ways that you think would be great to engage this sector. And I'd also like for two people to maybe come on the chat and say what ways they would like to reach out and try and engage this sector now that they've gotten a little bit more information about this sector. And we'll just do like a couple minutes on this particular activity.
Would you like that in the chat, Shay, or do you want people to share?
So I want everybody to kind of list two things in the chat that they would like to do. But I'd also like if somebody could come off mute and like just tell us what kind of things that they would like to do as well. So either or. You're right, Erin. Lots of people like food. Brownies and muffins do work, and so do chocolate chip cookies. And we also like engaging via in-person, and having that in-person networking works a lot better. I know that I was trying to engage a church for some more support in doing research, and emailing just did not work. And I actually had to go down to the church and make that in-place conversation happen. Free training to educate the population. Yes, that's a good one too. Invite to the coalition meeting, great one. Reach out to the congressional church and via a current coalition member, that's a great option. Kelly says, I'd like to see if there is a interfaith clergy group that I can reach out to, and we'll be further exploring local church faith community websites to see what work they are currently doing, and specifically try to reach out to those who are addressing mental health or substance use in some ways. Okay.
I'd like to mention, I think all of these are great suggestions also, but even as a pastor as well,
Yes,
I think it's also good to really call and make an appointment with the pastor and really
of
talk to
course.
the pastor, and really kind of, let them know some of the things that you would like to do and that you're interested in doing. And then they will kind of make those arrangements for you to be able to link up with or to have persons in the congregation come together. But I would start with the leadership of that congregation.
Of
Uh,
course,
to get
having
their-
that leadership input is always important, because of course, the church is going to know what the church needs. So understanding what they need and asking those important questions. Okay, what is it that you all need, and how can we be of service to you all? It's a two-way street. This is a partnership that we have. What can the coalition do for the church? We always think of, okay, what can the sectors do for us? They have all these things that they can do for us, but what can we do for them as well? So reach out to those people in leadership and see what you can do for the leadership as well. What kind of support can the coalition provide to the sector, the faith sector as well? Yes, thank you. Demonstrating Narcan, that's a good thing if they need Narcan demonstrations done for them. Inviting them to sponsor with another congregation, that's a good idea as well.
I'd like to suggest two things. One is doing an inventory of the faith-based organizations in your community. I think there's probably more than often we realize
Yes.
in terms of the variety of faith. And then the second one, if you're fortunate enough to be able to contact and connect with them, is talk about some more global issues. Like, what are their concerns for youth and families? What are their concerns around mental health? Because there's a lot of common ground. And sometimes that can be an opening for conversations as well.
Exactly.
And asking, what are you guys currently doing, or what do you see as a need that our community isn't providing right now?
Exactly.
Mhm. And I think the same thing would be if you are interfacing also with the ministerial alliances that are also in those areas, to really talk to the pastors, in terms of in a setting in which they would be able to kind of talk about some of those things that they are doing, some of those things, ways in which they are addressing, mental health, addressing substance use and those kinds of things.
Exactly. Thank you, Robin. So we talked briefly about how reaching out to those leaders within the faith-based organization. So I kind of wanted to kind of talk about more about what leaders within faith organizations do for their members. So leaders of faith-based organizations can provide their members with information on how to assist them to make those healthy choices for substance use. But not only that, they are that halfway point for reaching that congregation. And for the coalition leaders or for the coalition coordinators to go into the congregation, understanding what the needs of the congregation and the community are, it's best to go to that faith leader and understand what are the needs of that congregation, what are the needs of that community that are going to be most provided to by the coalition, and where can we as the coalition or as the prevention organization, where do we fit into all of this? So those are some things that will help you as you go forward is that the leader of the faith-based organization can help support your prevention efforts within the broader community by helping you organize these events and helping you with your prevention activities and getting you to the people that you need to network with, but also being that point of contact for you to network within their congregation as well. And some topics for things that you can organize for your education and events as well. I kind of wanted to add to this as you guys are developing different things that you want to do for putting together events and education within this sector, is understanding after you've done your needs assessment and you talk to these leaders, understanding what kinds of things that are necessary for this group. Is you could always sponsor a health day or co-sponsor a health day. I know when I was growing up within the church, a health day was a day that people were able to come in on after the sermon. There were things for everybody to do. Sometimes there was food available. Everybody stayed after the church and were able to be there and network, but also it was a day for some people to get services done that they may not have necessarily got done anywhere else within that community. Say blood pressures, they were able to get that done. Educations about secession, tobacco cessation were done during that time. Different things were provided to the children within that setting as well, such as getting their teeth cleaned if that was available. And this could also serve as an opportunity for the coalition to get information out to the community and have that available to have awareness about opioid use or substance misuse within that congregation when you have a large group of people available. You can also incorporate education for youth groups into youth education if it is allowed by that congregation, and help to build that prevention curriculum that is culturally and religiously relevant to the congregation and the population at that time, as well as encourage faith leaders to integrate content on the appropriate use and non-use of alcohol and other drugs into their sermon. So that's something you could talk about, especially with some groups have a cultural or religious wine drinking, and the shift into that cultural norm and how that might be an appropriate use or misappropriate use of drinking certain things within their sermon, and how they control those certain things. Right, Trina, mobile health and pop-up clinics. We used to do those a lot when I was younger. So those are some things to consider when you go ahead and have those types of events. Next, I want to also consider how you integrate and develop social norms changes within the faith sector. When you go into the faith sector, have a clear vision and guidelines around substance misuse and substance use for members throughout policy resolutions and position statements, and acknowledge that these policies and resolutions may vary for the faith sector and by denomination and their congregation. So go in with your strategies, but also assist faith members on individual responsibility about drug and alcohol use or misuse, and provide conversation tips and help them as you go through. You can help leadership if they are not necessarily well versed in prevention, with conversation tips and resources to help those who may suffer from or who are struggling with substance misuse. And also encourage input from faith members and representatives who might have specific needs within the organization. So I'd like to ask if anyone has any questions before we get ready to close out, and I have a couple of resources that I'd like to share with you all. Does anybody have any questions for myself or for our speakers who were nice and kind enough to share their experiences with faith sector and prevention efforts and strategies? Hilda.
Hi there. My apologies. I had a doctor's appointment this morning. So I had logged on late and missed, I guess, a good portion of your presentation today. But my question is that I am a facilitator for GRASP, which is Grief Recovery After Substance Abuse. And I am working right now with a lady who is an ORT, overdose response technician in Waterbury. And we had a meeting yesterday, and this is something that we want to do, get a round table of faith-based churches in the Waterbury area to get people talking, get conversation, get the stigma, so that, because a lot of people, it's our family business, you don't talk about it to other people. And we're looking to target the Waterbury area and the faith-based, the Black and the Brown and the Asian. And so I'm, just need all the help I can get, to start this up. I mean, we just had a meeting yesterday with Rushni's supervisor, and he's given us the go ahead, but I need some guidance and direction.
Okay.
I can talk a little bit about that. Waterbury has had sort of a low-key, small local prevention council funded by the state for several years, and it just got a new grant last year to really grow that council. And I would be happy to put the Brianna DaCosta from the health.
I saw Brianna yesterday.
Okay, because I was going to say she would be at the health department. Okay.
That's exactly where I was, but we want to do this. We don't want to call it a support group because we think that people are just gonna oh, I don't want to do the support group. We're calling this like a focus round robin table to get everybody together. And as I said, I missed most of this because I was listening. I know you asked for a bunch of questions, but I was driving, so I was listening and driving at the same time, so I didn't get to ask any questions, put anything in the chat. But
so when we're done with
what
we could do is when we're done with the presentation, you can hang on and maybe get some clarification and resources at the end.
Perfect.
Happy to fill in a little bit at the end when we're done, if you'd like to hang on a little bit after.
That I would love that. And if I can get a somehow, if I can get a link to watch the presentation again, I would appreciate that.
We'll send that out.
So much.
Awesome. We're going to have more time for questions, and if anybody wants to hang on after for that too, I'll let you guys hang on for that. But I kind of wanted to move on and give you guys some resources as well. So this is a map of the Connecticut Regional Behavioral Health Action Organizations. Some of you may know them. There's the Hub, Legions for Prevention and Wellness, CIRC, Amplify, and Western Connecticut Coalition. TTASC has also created some tools for use in the faith sector. This is the congressional checklist for assessing substance abuse treatment, prevention and recovery needs, as well as the faith sector substance prevention assessment. Both of these assist in assessing current efforts and plan future policy programs, as well as understand current organizational readiness for prevention efforts within these communities. So these are some of the resources that I will be emailing all of you today, as well as a level of collaboration tool for you to bring some understanding about how you work within the space of involvement with the faith sector, but also how you work and involve yourself with other sectors as well. And these are Appendix C and Appendix B for cultural competency and also sustainability within the SPIF for how you maintain sustainability and cultural competency as you build your strategies, prevention strategies for working with this sector in the SPIF. And like I said before, I will send you all these slides as well as all the resources that I'm going to send you. I have quite a few to send you. So if you get a big email, that's what it is. I have, like I said, plenty of resources for this, this sector. And I'm pretty sure that Reverend Victoria, as well as Reverend Reverend Robin, have also given their contact information as well. So if you registered for the event, it will come to you.
I also wanted to say one thing is our pastors, ministers, reverends, rabbis are incredibly busy people. Not
Yes.
only are they planning their weekly or more than that services and programming and educational programs and reaching out individually to their members and responding to emergencies. They're busy, busy people. So if they're not able to support or join a coalition, they may be willing to be a partner, you know, where they can share information and they can give advice on different things, and they may be able to identify a person in their congregation who may be interested in the coalition work, who has a passion or an interest in that as well. So, you know, ask them about that as well. I like to say that faith organizations are informal leadership development organizations, that there's a lot of leadership opportunities often going on in faith organizations, and people gain really great skills, organizing, public speaking, and so this would be an opportunity for them to apply those skills as well. So thank you, Shay, and thank you, everyone.
Thank you. I've also compiled some other additional resources that I found throughout a couple of my searches with the PTTC network, as well as the National Harm Reduction Coalition, as well as a couple of other books and things that I've read throughout my time doing health promotion and prevention. Something to note about some of these resources is that they are very Christian centric. So if you find that you are working with a group that is not a Christian group, such as a Muslim, a Judas, Buddhist, other type of religious group, that sometimes these might be helpful resources, but everything may not always apply. Even within different Christian groups. Catholicism is different from Protestantism. So just be aware of that as you go through some of these resources, that everything might not apply to all of the different resources that you have, and to always keep learning, especially as you go through some of the communities within your the religious communities within your own community, is to be culturally aware of some of the groups within that community, and ask questions if you have questions about those different communities and where you can find resources if you'd like to learn more, partner with those communities as well. Next, I also have love if you guys could provide us with some feedback. My colleague Jen Jacobson has put the survey link for our training into the chat box. So if you can take a couple minutes, it should take no more than 5 minutes to fill out the evaluation links on how we can make this presentation better, what you liked, what you didn't like. It would be greatly appreciated. This tool will go up on our website, but for you guys, I'm going to email it to all of you. If you have any questions or want any support for this presentation, support for the faith-based organization, this is my email address, and I am also here to answer questions. You guys can send me questions if you have them, and I am here to support you all. But if you have any questions, our Reverend Victoria and Reverend Robbins are both still on. As well as some of my colleagues from TTASC are still on. So if you have any questions about engagement or involving yourself with faith communities, especially, I practice Buddhist faith. So if you have any questions about that faith too, I can help you with that. So if you have any questions, please let us know and how we can help you to engage with these populations within this sector. So I'm going to stop sharing and also stop recording.